Dr. John Spencer, and welcome back to STEM Forward, where we dive into the world of science, technology, engineering, and math careers. We're going to continue with our theme from this last episode, looking at various healthcare professions as assistants or aides.
Hi, I'm Dr. Stephen Jones, and today we're talking about a vital role in healthcare. That's physical therapists, assistants, and aides. These professionals help people to regain movement and manage pain after injuries or illness, playing critical parts in their recovery.
Yeah, it's a growing field with many opportunities, and today we'll explore what these jobs are like, how to become one, the work environment, salary expectations, and the job outlook in similar occupations. I know, Stephen, in my lifetime, I've had several instances where I've had to have some sort of physical therapy. So I know I've definitely encountered physical therapists, assistants, and aides.
Well, I think for me, it's kind of funny because I played football a long time ago. Maybe some of these things are coming back. So I've had to have some physical therapy as well. So whether you're thinking about starting a career in physical therapy or just curious about the field, stick around as we'll break it down. And don't forget that if you like what you hear, subscribe and share this podcast, STEM Forward with others.
So let's start by discussing what physical therapists, assistants, and aides do. These professionals work under the supervision of a physical therapist, helping their patients recover, mobility, manage pains from injury and illness. Some of the illnesses that they assist with or injuries that they assist with could be sports injuries, like you were just talking about, Steve. And with sports injuries, you can have neck pain, back pain, knee pain, hip. I know one of the things that I got with working on my dissertation and all that typing was carpal tunnel syndrome. Spending a lot of time at the computer, got our computer warriors out there tapping on those keys and end up with carpal tunnel syndrome. You have rotator cuff tears, knee ligament injuries, concussions, strokes, spinal cord injuries, and traumatic brain injury. So there's a lot of different things in which you can go to physical therapy for, and assistants and aides play a vital role in that.
And just like you talked about the various aspects of it, I remember, they didn't have a lot of, in football and NFL, they didn't have a lot of protocols around what happens with the trauma of hitting each other and concussions that the players were having. So, now they take it seriously, but still, it may require some therapy in certain kinds of sports that are out there.
I remember playing high school football. There was no medical professional. I mean, there might have been a trainer.
Uh-huh.
I know now most times you'll have some sort of physical trainer or somebody out there to provide support in case somebody gets hurt. But we played in the Stone Ages, Steve. So there's definitely a lot more support out there now for our young people.
Yes, and we need the physical therapists and or PTAs, as they're called, directly involved with patient care. They assist patients with exercises, stretches, gait training, and more. They also help educate patients and their families about post-traumatic treatment care.
Yeah, so physical therapist aides may also assist with some other chronic conditions that include chronic obstructive pulmonary disease, COPD, cerebral palsy, multiple sclerosis, muscular dystrophy, Parkinson's disease, and cystic fibrosis. They also perform some indirect tasks related to patient care. They clean up and set up treatment areas, which is very important. They help patients move. They do clerical work that may involve scheduling appointments as well.
Both roles require empathy and great communication as they spend a lot of time with patients and their families. Whether assisting with exercises or setting up therapy equipment, every task is essential to the recovery process.
As we stated in our last episode with occupational therapy assistant and aides, communication is a vital
Yes.
component of
Mhm.
this and any job. One of the things I talk to parents, even though we talk about, sharing our podcast on YouTube, Instagram, TikTok, and other social media platforms, one of the things I want to implore parents to do is make sure you're regulating screen time and interacting with your child, because initially those communication skills are built at home and then honed at school. So, if children are spending a lot of FaceTime with their phones and other electronics and not really engaging with people, you're really putting them at a disadvantage, whether it's in school, socially, and eventually in the job market, because they won't know how to interact with people. So, like I said, we're using social media as a business tool to make sure we get our information out there about these possible STEM career pathways. But communication
Mhm.
is a big part of this job and every other job. Because, like I mentioned before, in our last episode, these types of careers, the people that you're working with are many times in a very vulnerable condition. And
Mhm.
so effective communication helps you build trust with the people that you're working with,
Mhm.
to help them recover to move forward within their treatment. So if you're interested in a job like this, helping people regain their independence, this may be a perfect fit. But if you see or think of your child is maybe interested in something like this, you have to be very intentional about screen time and use of technology, and make sure that they're honing their verbal and written skills when it comes to communications. So remember this as we move forward in this episode. And if you're following STEM Forward, encourage people to subscribe, share, and let us know your thoughts as well as we dive into this even more in subsequent episodes. So let's take a brief break and we'll be back.
Now, let's talk about how to get started in the field. For physical therapist assistants, it usually requires an associate's degree from an accredited program. These programs typically take about 2 years and cover subjects like anatomy, physiology, and kinesiology.
That's right, Steve. After graduation, you'll need to obtain a license or certification to practice. These involve passing a national physical therapy exam for PTAs. In some states, there's an additional requirement, such as criminal background check. But as I said in the last episode, or many of these careers that we're going over that just take a 2 year certificate or degree program, that's a window between 18 and 20, and we'll talk about it more when we actually talk about the wages and different things in the work environment. But that is a tremendous advantage, you know, um, especially when it comes to economic sustainability.
Mhm. And sometimes there are courses that you can take when you're getting ready to complete that national physical therapy exam. Sometimes they have integrated into your courses a course that specifically has to do with that. So if you're nervous about taking exams after you complete it, and it also is important for the the community college that may be offering this, that they have students who are passing the exam because they're evaluated based on that. For physical therapists, aides, the path is a bit different. They generally need a high school diploma or equivalent and receive on the job training, which can take anywhere from 1 week to 1 month.
So 1 week to 1 month, depending on who you're working for, what type of situation that you're in. But this is definitely a great option if you're looking to get into the healthcare field without spending years in school. Whether you're a PTA or an aide, the hands-on experience is a must. You'll likely find roles in hospitals, physical therapy offices, or even home healthcare, especially with this aging population.
Yes. And we just went through a whole situation with COVID and all the different challenges that we had there. And there were so many different needs within the healthcare field. So even coming out of it, there's even more roles and probably more areas that people may have retired. So the windows and opportunities may be even greater because people decided to get out of the field and now they're open doors. So I think you definitely should consider this. And don't forget that both PTAs and aides need to be compassionate and have good physical stamina. So it's going to have some physical demands to it. But every day, I'm sure we'll have different challenges. You'll meet with different people. You have different experiences with them, different conversations, and so it'll keep it as a thriving experience for you. Um, you may be on your feet for a while during the day, or if you're working in the evening as well. Moving patients or setting up equipment. There's many different ways that you're going to get that job done.
hmm Yeah, so I definitely don't want to downplay the physical demands of this job. It can get very physical demanding, especially when it comes to moving patients. So that's something you have to think about when you're looking at a career, especially in healthcare, because you may have to maybe lift somebody on a stretcher, lift somebody from a bed or something of that nature. So you got to make sure you're in good shape and good health yourself, so you can actually perform the duties of the specific career that you're looking to. I mean, this is a great opportunity. If you like helping people, it's definitely a growing field, and physical therapy might just be the way to go.
Mm-hmm.
As always, subscribe and share, and stay tuned as we discuss work environment in the next segment. Are you a solo entrepreneur, entrepreneur, or small business owner looking to establish a strong online presence? At Teach It Labs, we specialize in creating mobile-friendly websites tailored just for you. Our customizable templates are easy to showcase your brand without any coding experience. Plus, with our learning management systems hosting, delivering educational content online has never been simpler. Ready to elevate your business? Visit teachitlabs.com and let's build your digital future together.
And we are back. When it comes to the work environment, both PTAs and aides spend a lot of time on their feet. They work in physical therapy offices, hospitals, and even nursing homes.
So, like I was saying right before the break about how physically demanding the job is, you're definitely going to be moving equipment, definitely going to be moving people. But one of the things you got to keep in mind how rewarding the job is, because you're directly contributing to somebody's recovery and treatment. You are really going to have an opportunity to impact somebody's life, and possibly on a day-to-day instance.
And if you know you're a patient and caring person, it won't seem like work because you'll go and you'll see progress. You're working with them, they get better, you feel better. Even sometimes I'm sure they come back and say thank you for the work that you've done with them. So in terms of pay, physical therapists, aides earn a median annual wage of around 33,520, but PTAs make more, about $64,080 annually. Of course, salaries vary depending on the location and the industry.
And Steve, I'm going to keep coming back to this every time we highlight a job like this. You graduate high school, you're 18 years old, maybe 19.
Mm-hmm.
You go to the local community college or some other accredited institution that provides healthcare training, and you become a licensed assistant or aide in physical therapy. Because the outlook for this job is great. I mean, they're projected to have growth of 25%
That's
over the
amazing.
next decade, which is much faster than average. There's about 27,500 job openings expected each year due to retirements, increased demand for physical therapy service, particularly amongst the aging population. So this is something. I mean, just think about it. Like you're 18. I mean, you're 20 years old, making $64,000 in America. You have opportunity to further your education on your own, or like I said, people may get tired of me saying economic sustainability. That's the whole point of going to school, to make sure you can take care of yourself as an adult and live a life that is fulfilling. So economic sustainability is the key, and STEM careers have an opportunity to help you with that.
And also, if your son or daughter is in high school right now, that's a great opportunity to explore the outlook for different types of careers. This is just one of multiple STEM careers that you can explore. If you're thinking about, sometimes people think that they want to be a nurse, for example, but
Mm-hmm.
that's only because they don't know all these other options that are available. So that's why I'm saying to you, have your son or daughter explore, um, maybe have them take even a career test just to see what comes out of taking that career test, to give them some input on the different aspects to consider. And I just want to mention also, there's something called a dictionary of occupational titles. It's a dictionary of occupational titles. It has a description of all different types of careers in it and the salaries that go along with it. So that's something to kind of take a look at.
So one of the things we could definitely include on the show notes, and after each of our podcasts, if you visit our website, stemforwardedu.org, click on the various episodes, there'll be show notes with different resources for what we just talked about in the podcast. We could definitely put up a career inventory. There are many of them online, and your child may even take one in school, and you might not know about it. Maybe ask the question: have you taken a career inventory? Maybe with your counselor or your teacher, to see what types of careers that you're interested in. That is data that's usually tracked by K to 12 institutions, and sometimes as low as third grade with some of the
Oh.
systems. So that is something you definitely take advantage of.
And I think it's interesting that you bring that up, because what we don't do is take advantage of, because we don't see anyone in our families that are doing the thing that we're interested in. As a young person, you might say, I don't have a physical therapist in my family, but that doesn't mean that you can't do it. So that's why I'm suggesting exploration, possibility of maybe going to talk to a physical therapist to see what
Mhm.
the job is like, or sometimes they have what's called shadowing day, where you can actually
Mhm.
go and spend a day with someone. So I think those different kinds of exposures really help you to get into the field, understand more about what it is, and to grow along with it. And as I'm looking at the growth, there will be an increase of over 3%. But the demand for PTAs remains high, especially in long-term care and rehabilitation uh, environments.
So with what you just said, parents, um, make sure you maintain an active role in your K to 12 child's school life. Make sure you're in contact with the school to understand what types of opportunities before, after, and during the school day beyond the curriculum, because schools offer a lot of different things. And sometimes, schools will send home calendars and different announcements, and they get lost in that black hole of a school bag, and you never know what's going on. So you can't always wait for the communication folder or something to come home with a child, because it doesn't always work out like that. Stuff gets lost. And so I would definitely say make sure you're in constant contact with the school, because the more exposure your children have to various opportunities, it gives them an advantage, because it helps them imagine, what they could be, what opportunities are available for them. So if you're looking for a career with a bright future, this is definitely a field worth considering. You definitely can help people. It's just not a field that's growing exponentially. It's also a stable career path with a real chance to make a difference in people's lives.
I think the other aspect of this is you get to work with physicians, nurses, so you get to understand the whole complex field of healthcare. And who knows how you might want to grow within the profession just by meeting other physicians and doctors. Another person that you can talk to, I would recommend, is if you have a family physician that you regularly see, to ask them. They may have some ideas, or they may have some friends, or they may have some connections where you can actually do an internship in the field, or to get more of your questions answered. So I think that person who's in your family already and that's connected with the field, also is another thing to look at. Sometimes we don't even know that our cousins or aunts or uncles are actually in this field, but you start asking questions, you talk to your parent, and you find out that there's a great opportunity available to you. So don't miss out. Don't miss out, because it's a great experience that you could have in healthcare.
Yeah, yeah, it definitely is. Definitely is. I mean, you have to know what your own internal resources, like Steve said. Sometimes it just starts with asking a question. So that's all for today's episode on physical therapy, therapist assistants, and aides. Thank you for joining us.
Yeah, and before we wrap up, if you found this episode helpful, remember to subscribe to STEM Forward and share it with your friends who might be interested in exploring careers in physical therapy.
I'm Dr. John Spencer.
And I'm Dr. Stephen Jones. We're
See
glad
you
you
next
spent
time.
time with us today.
Yep. Have a good one.
Thank you for tuning in to STEM Forward. For more information about this episode, visit our website and check out the show notes.